To ramp up the COVID-19 vaccination drive have been incredibly loud, haven't they?
They have indeed, but how safe is it amid the third wave of infections? Around 3.4 million people in South Africa alone have so far received their jabs.
Experts once again reassuring the public about the safety of vaccines. Here's Heidi Giokos taking a look at that.
Even though the infection rate remains high, the plea is for the rollout of the COVID-19 vaccine not to slow down. Experts are also trying to allay fears, saying the vaccine cannot give you the virus. Instead, you've likely contracted it before you got the jab.
It's just important for the public to understand that should individuals become infected with the virus and develop COVID, especially in a 7 to 10 day period immediately after having been vaccinated, it's not the vaccine that has caused them to develop COVID, because the vaccine is not a live virus. In fact, the vaccines that we're using has got no ability to cause someone to develop COVID. But rather, the reason why they're developing COVID, and unfortunately a minority of them are ending up in hospital, is really because they were already probably incubating the virus.
Testing for COVID-19 before one gets the vaccine is also not a solution.
It's not pragmatic to be able to do that, because as you know, for the results to come back, and the rapid test might give you an answer within a few minutes, but the rapid test is not sensitive enough to exclude individuals that are infected, especially at an early stage. So the type of testing that would need to be done is a PCR test.
The health department says even though COVID-19 cases remain high, the vaccine rollout will most likely be ramped up.
It's very important that people get vaccinated. The sooner we have enough people vaccinated with the vaccine that creates immunity, the better. And the more people who we are able to reach as quickly as possible, we would like to be able to do that. Definitely a concern. Everybody should be concerned. Everybody should be protecting themselves and taking this pandemic very seriously.
The department plans on opening up vaccinations for more cohorts as soon as 75% of the 50s group have been vaccinated. Heidi Giokos, Johannesburg.